There are several steps how to create this health plan. And one is to choose your primary diagnostic, your number one diagnostic. If you go to Bruxelles Clinic, to Peter Mendel Clinic in Bruxelles in Germany, then you will see that basically the base, the really firm base of diagnostic is what is called Kirlian Photography or energy emission analysis. So there is this big machine which takes pictures of ends of meridians on your fingertips and toe tips, and then you receive the treatment based on this, and then you take a control picture, and then basically they figure out how the treatment worked, if it worked, and so on. So the basis of traditional Colourpuncture, classic Colourpuncture, really professional, formal Colourpuncture is Kirlian Diagnostic. However, not everybody has Kirlian machine. Not everybody go to clinic. Sometimes what people choose for different reasons. Sometimes people live remotely. Sometimes people don't feel like going and connecting with many people. They just want to have their set. They want to have some guidance, some online learning, some book on Colourpuncture, some short workshop, and they want to start developing on this. And you still need to somehow tap into this diagnostic thing. Now, fortunately, apart from Kirlian Photography, Colourpuncture has lots of other diagnostics. And then you need to choose which one is the one which you feel you can use. So, for example, some people go with traditional diagnostics that they're trained with. If you're a practitioner of other therapy, then you can go with your diagnostic. If you're an acupuncturist, you can go with your pulse diagnostic, your tongue diagnosis. If you're a reflexologist, you can go with your reflexology diagnostic from zones of the feet. If you're a massage therapist, you go for your zones diagnostic and so on. If you don't know anything at all, if you are somebody who is just starting in Colourpuncture, or somebody who wants to be as close as traditional Colourpuncture as possible, but without Kirlian machine, you can start with fingertip diagnostic. And fingertip diagnostic is something that you're likely to learn with any workshops that you have, because this taps again into this meridian information, and from this you can figure out your long-term plan. Sure, any particular day, one of 5 fingers on one of the hands is going to be particularly sensitive. However, we do have the saying in Colourpuncture that this is a little finger person, this is a ring finger person, and so on. Meaning that long-term, the same patient, even with really good treatment plan and treatment strategy and diligently doing their homework and so on, they tend to have the same weak area, which is again coming back to our previous point about what you inherited from the family. There are certain areas in your health which are always going to be weak areas, and that's okay, because all we need to do, we need to know that they exist, and we need to know how we can support them so we can create best possible condition for their functioning. So fingertip diagnostic, this is the most close diagnostic to Kirlian.